Before you pop another pain pill, hear this. If it's caused by spinal stenosis, knowing where the narrowing is can change everything. Today, we're breaking down why people with lumbar pain must understand two types of spinal stenosis. I'll show you where they occur using the spine model and explain how each one affects the body differently. By the end of this video, you'll be able to understand what's happening in your spine, identify the symptoms of each type of stenosis, and learn how to communicate more clearly with your doctor. Let's get into it. I would like to let you know that I am not a doctor and this video is not medical advice. I am sharing my personal experience with lumbar spinal stenosis to raise awareness and help others that may be going through the same thing. My mission is to provide care, community, awareness, resources, and empowerment so that those living with spinal stenosis feel supported. Welcome to Living with Spinal Stenosis. I'm your host, Miss No More Back Pain. When discussing spinal stenosis, there are two types to focus on: central canal stenosis and foraminal canal stenosis. Both involve the narrowing of the spine, but they affect different areas and can lead to different symptoms. This is a vertebrae, so I'm going to show the spinal cord as a yellow dot. Notice that there's space around the spinal cord and there's nothing touching or compressing it. In a healthy spine, this canal is open, allows the spinal cord and the nerves to pass through freely. With central canal stenosis, this space gradually narrows due to factors like disc degeneration, thickened ligaments, or bone spurs caused by arthritis. Imagine this tunnel shrinking inward. This puts pressure directly on the spinal cord. The narrowing of this passageway is called central canal stenosis. This is your vertebrae. Here's your spinal cord. Your spinal cord goes down the center of your vertebrae. There's plenty of room for your nerve to move around without compression. As your spine begins to narrow, there's less room for your spinal cord to move around without compression. That's central canal stenosis. Here's your spinal cord. Here's the base of your skull, your cervical spine, your thoracic spine, your lumbar spine. These are the vertebrae. And of course, the nerves are indicated with the yellow. Inside your vertebrae runs your spinal cord. But you also have nerves that come off the sides of your spinal cord. This hole on the side where the nerves come out your spine is called the foramen. Can you see me talking through that hole? That is the foramen. The foramen is where the nerves come out the side of your spine. Okay, so you saw me talking through that hole, the foramen. Now, this was the vertebrae. This is your spinal cord. So these are nerves, right? Okay, you got the central canal stenosis, right? So now there's nerves that come off the side. Nerves come off the side, and there's plenty of wiggle room. They come off the foramen, then the sides of your spine to begin to narrow, and you get compression of the nerves. That's called foraminal canal stenosis. Central canal stenosis can cause bilateral symptoms, meaning you might feel pain, numbness, or weakness in both legs. People often describe a heavy or tired feeling in their legs, especially when walking or standing for long periods. A key sign of central canal stenosis is neurogenic claudication, where pain worsens with activity but improves when sitting or leaning forward, like when pushing a shopping cart. Unlike central canal stenosis, foraminal stenosis is usually unilateral, meaning symptoms typically occur on one side of the body. You might feel sharp burning pain radiating down one leg, along with tingling, numbness, or weakness. A telltale sign of foraminal stenosis is positional pain. It may worsen when standing or bending toward the affected side and improve when bending away from it. Here's some of my experiences. I have central canal stenosis, where there is impingement onto the middle of my spinal cord. And I also have foraminal canal stenosis, where there is impingement on nerves that come off my spinal cord and go down my legs. What does that feel like? Well, when it first started, it would be hard for me to get in and out of a seat. As a bus driver, it was hard for me to get up out of the seat and to sit down into the seat. My spine felt like it was a very rusty hinge of a door that could barely open and close. That's what it felt like. It had a lot of difficulty moving. There was pain that would go down my legs, and more specifically for me, it also included into my right knee. Many people that have spinal stenosis, or most people actually that have spinal stenosis, also have hip problems. So on my left hip, I developed edema, which is fluid and swelling and pain that would come from the compressions of the nerves in my back that travel down into my hip. How do you know if you have spinal stenosis? Typically, you have to get an MRI, and the MRI will indicate where and which levels of your spine that you have central canal stenosis and or foraminal canal stenosis. My MRI indicates that I have central canal stenosis and foraminal canal stenosis and the impingement of different nerves on the left and right side of my lumbar spine. This is called an invisible disability because it can be hard for people on the outside looking in to see you as having anything wrong with you. Because if you can walk and you can talk and you can wash the dishes and you can lift the bag of sugar, then they think, oh, there's nothing wrong with you. But I remember in the beginning, it was very hard for my children to understand that I was in a lot of pain. I remember going to Walmart with my son and he wanted to go shop. So I said, okay, I'll take you to Walmart, but we only can be in here for a little while. So I walked in, and by the time I got to the back aisle where the furniture is, they have metal crates, metal stacks that hold the furniture. And by the time I got to the back of the store, I had to go. So I was contacting him and I was telling him, we have to leave. I can't do this anymore. And he's, a young teenager and he's still trying to shop. And I'm saying, no, we have to go. So I found myself holding on to the metal bar that had like the TV stands and the dressers. And I'm just holding on to the metal bar. And he comes to me and I had tears in my eyes and I'm like, we have to leave. I can't walk. And I think that's when he understood that I was serious about what I was feeling. If this helped you understand the difference between central canal stenosis and foraminal canal stenosis, then you're already one step ahead. The more we understand, the more we can advocate for ourselves. If you've had an MRI or have symptoms like this, leave your experiences in the comments. Don't just treat the symptoms, ask your doctor where the narrowing is. Do I have central canal stenosis? Do I have foraminal canal stenosis? If you're having back pain, please consult with a licensed healthcare professional to get a proper diagnosis and treatment plan that's right for you. If you've made it this far, then you already understand spinal stenosis is something that people with back pain can't afford to ignore. Take it from Miss No More Back Pain. Click on the next video and let's keep going. Up next, why people over 50 must recognize the warning signs of spinal stenosis.